We're going to take a look at images for a CT scan. Most CT of the chest are done with IV contrast. However, there are times that some studies call for non-contrast CT of the chest. Those are different scans, but for the most part, a patient will receive contrast, IV contrast, to highlight the vessels of the chest. When we scan, we can start with the patient either feet first into the scanner or head first into the scanner, depending on what studies you are performing on that patient or if the patient is a trauma patient. Obviously, you will set up a scout for your scan, and you want to start at the very top of the chest, and the scan normally ends at the very bottom of the chest, but you want to include the adrenal glands, which are sitting on top of the kidneys. You will prescribe the scan according to the protocol at your site, and just like in x-rays, when we're looking at images on our screen, our scanner, we always want to make sure that we know which is the right or left side of the patient. And some of these have it on way on the periphery of the film. You'll see that these are denotes that this is the right side of the patient. Again, radiologists and technologists, when they're doing CAT scans and they're looking at images, are always looking at the scout just to verify that they're at the level that they think they are. And there's landmarks that can tell you where you are. For example, an image that shows the air-filled trachea will tell you what level you are. But if you're looking at an image below the carina, you'll see the bifurcation of the trachea into the right and left bronchus, and I'll point those out as I move through my images. This scan shows the patient that was given IV contrast. You can see all the highlighted vessels. You're also going to see the aorta and the heart filled with contrast as well. Again, we'll start at the top above the lung field, so you're going to see some of the humerus, the trachea, the thyroid, jugular vein, left carotid arteries, muscle. This is where the patient is lying on. It's part of the couch. As we move further down the scan, we're still going to see some bony structures, the spinal cord, thoracic spine, spinous processes, scapula, humerus, clavicle, air-filled trachea. And as we move further down, we'll start to see the sternum, or a little bit below the clavicles. You can see a little sternoclavicular joint space right there, more of the ribs. And now you can clearly see lung tissue. All those little white specks are also contrast. You have your left common carotid artery, your left subclavian vein, your left subclavian artery, all the way up there. I'm going to take this down. Now we don't see the sternal manubrium. Now we see more of the end of the body of the sternum, but we can still see some ribs, the scapula, muscles, thoracic spine. And remember, the thoracic spine is always going to have ribs attached to it. You can also see the esophagus back here. In this case, you can see it because there's a little bit of air in it, but sometimes you don't see it with air, so you'll see just the muscle around it because it's a muscular structure that propels your food down into your stomach. Again, lung tissue, right lung, left. And you can see the ascending aorta and the descending aorta. You can see the pulmonary arteries right here and the superior vena cava. If we were to look at an image above this, you will see the actual arch connecting the ascending and descending. Moving slightly inferior towards the feet of the patient, you can see that the scapulas are starting to disappear. You can also see the right and left bronchus. You don't see the air-filled trachea anymore. You can clearly see the lobes of the lungs, thoracic spine, ascending, descending aorta, and right there you can see the esophagus. You may have noticed that the contrast on this image has changed from the priors and after. And that's just to show you that this is a lung window. We're looking at the same patient scan in a different window. So we want to focus our eyes into the lung tissue. So it has made everything else look a little brighter, but it's also lost some detail. Like the muscle looks a little wider and the bone is a little washed out. That's because we changed the window. Our focus right now is in the lung tissue. If you look at this image, however, the lung is just black. There's no definition, no detail. So in this case, we're looking at the vessels and the bones a little better. Again, you can change your windows to look at different structures within the same anatomy. That's why there is a difference between these two images. Okay, moving further down into the scan towards the patient's feet, we can see the left atrium, the right atrium, and we are almost all the way past the scapulas. Our last image that I have here, not of the scan, but this image, we still see lung tissue down here, but we're starting to see some of the abdominal organs, such as the liver, the spleen, and you have stomach here. Again, we would continue to scan the patient until we reach the adrenal glands, which sit on top of the kidneys. And you want to make sure that you've gone through all of the lung tissue when you're doing a chest CT. And that's it for CT of the chest.